Hi, I'm Judy Jacobs, and I'm retired from Windrose Health Network after 22 years. The reason I went to work at Windrose Health Network was because there was a posting, and it was about this new, innovative, state-funded healthcare center in the middle of Trafalgar, Indiana, which was very rural and very underserved. And the neatest thing is you could be seen there whether you had medical insurance or not. And if you did not have medical insurance, you could pay according to your income. Well, that was very interesting to me because for many, many years I struggled with healthcare costs and trying to keep insured. I had 2 children and it was a very rough road for me. Most of the time I'd have to go on payment plans, and with my income, it was very, very hard to meet the payments. But I applied. I was very excited to apply. And when I applied was in November of 1996. It was myself, and they hired an office manager and a receptionist. We started off in a very, very small center. It had 3 exam rooms, 1 procedure room. Of course, these rooms were all very small. A front office, a little tiny kitchen, and the kitchen had a little round table that you could squeeze, and I mean squeeze, 3 people in. In the back, there was a nurse's station in the middle of the offices, and that was it. And the first day we started, I always remember this, we really didn't have all of our supplies, but we went ahead and opened, and myself and Dr. Simon Fung, who was a temporary physician we hired, we started our day, and we was very, very excited to start our day. We greeted our patients with a big smile, and I think we saw 8 patients that day. The state government had provided this innovative new center in the middle of Trafalgar. And it was something really kind of hard for the community to get used to. They were very skeptical, but they did come. And as we went on, they learned to love Dr. Fung and grew the practice pretty quickly. Then we hired a nurse practitioner. Well, it didn't take long, but they absolutely loved her, and the practice grew leaps and bounds. When I quit working in 2018 and retired, Trafalgar Family Health Center, Windrose, had acquired all of that strip mall. Around 2003, became federally funded. That totally changed the makeup of the center, because to get federal funding, the CEO, the CFO, and a nurse manager and a medical director had to be staffed in the centers. It was very exciting through all of that process to see the changes in the communities and in the population. I really feel like those centers provided a step for people to start getting out of a poverty situation and to kind of get their lives together and move upward. And I guess one of my most memorable things is the fact that for 22 years, I was always, one of my roles, and I had many roles, was to provide or help structure for our extracurricular activities, meaning health fairs, holiday parties, summer picnics, National Health Center Week, whatever it may be. I loved that part of my job. It was very exciting to put the events together And it was very exciting to attend the events and see the happy faces. Our staff deserved everything and anything that they could be given, and Windrose did an excellent job with that. I really feel like Windrose Health Network allowed me and pushed me and helped me to grow professionally, in my family life, in my social life, and my private life. They offered so many opportunities for educational development, and they awarded me immensely every time I reached that plateau and every time I gained that knowledge. So I moved up from medical assistant to director of outreach and community relations. In the next 25 years, I would love to see Windrose Health Network add dental services to adults predominantly. Most children have Hoosier Healthwise or medical insurance for dental, but adults are left out. And it's such a huge need for all of the communities. So that's one thing I'd like to see in the next 25 years. The other thing I'd like to see is a daycare center for the staff that's reasonably priced, or even a co-op opportunity. I feel like that they have changed many lives, including my own, have helped many people, and will continue to do that. And through it all, they have always kept their mission and values and vision, and it's very important to them. And those values are to offer compassionate, affordable care to anybody, regardless of your ability to pay. And to me, that is a blessing. Thank you, Windrose Health Network, and congratulations on your 25 years.